Good morning and welcome. We want to thank you all for coming this morning. My name is Helen Matheny and I work with WVU Health Sciences, and I'm a member of the task force along with my colleague here, and I'm going to let Dale introduce himself here in a second, but we just want to thank everyone for coming. We look forward to hearing from you, and we'll begin shortly.
Good morning. I'm Dale Lee. I'm the president of the West Virginia Education Association. I'm also a high school special ed math teacher at Princeton High School. I'm on leave to serve as president. And thank you for coming out. We're excited to listen to your concerns.
So as you all probably know, we're having 21 sessions across the state to hear from you and to seek your suggestions in terms of what the fix might be for PEIA. We encourage you to fill out the survey that you picked up at the desk when you signed in. We have the sign-in sheets here, and we'll just go through the order as folks signed up. And we just want to make sure that you all know that we want to make sure that you feel as though you have been heard. So we want to give everybody a chance to talk. And when I call your name, if you would just come up to the microphone here. We are recording, and it's a live stream across the state. We have 29 total committee members, task force members. We're just 2 of the 29. And so the other members can either view live stream or in the recorded format. So again, we're trying to make sure that your voices are heard. So we'll start this morning with Thomas Bain.
Good morning. As Ms. Matheny said, my name is Thomas Bain. I am the staff representative for the WVEA, who proudly represents Pendleton County. I first want to thank the task force for coming out to Franklin today and meeting with all of us. I think you've heard, I'm sure, in the past several weeks, and you'll hear today and you'll hear continuously, the plight that people are facing, whether it's deductibles, co-pays, medication covered, and especially in an area like Pendleton County, out-of-state network coverage. I'll allow the people who are being directly affected by that address those problems. Now, the fact remains, even though we are in a freeze for the 2018-2019 fiscal year, we're going to run into problems come July 1st, 2019. And we need to find an effective way to fully fund PEIA or to fund PEIA. Now, there are several ideas that have been bound about, and I don't think there's a quote-unquote magic bullet that one revenue source is going to directly fund PEIA. I know the gas and oil severance tax has come into play a lot, and I know the money that comes into that won't be a full-fledged funding source for PEIA. So there's several other revenues I think we need to recognize and at least acknowledge. I think the sports betting aspect that has been passed by the legislation and the money coming from that could be a funding source. I also think that the passing of the medicalized marijuana should be a funding source for PEIA. There's a corporate tax cut of, I believe, 9% that has not helped the state really in any way, shape, or form in terms of revenue. To cut that would add more money to funding PEIA. Now, as I said, there's not one thing of the 4 that I mentioned that'll go solely to PEIA and will solely affect it and solely solve the problem. I think we're well beyond that now with the way nationalized healthcare has gone. But I think if we dip our pen into 2 or 3 inkwells, we can find enough to offset the damages folks are facing, whether it's deductibles, co-pays, funding for medication, and hopefully, when you come to an agreement with what the task force is going to propose, and hopefully we do our part and we vote in folks into office in November who are going to pass that PEIA can come to a full-fledged conclusion. Thank you very much.
Thank you, Thomas. Next is Jane Yoakum.
Good Good morning. My name is Jane Yoakum. I'm a Pendleton native, a Grant County resident, and I work in Hardy County. So I think I understand things across the 3 counties. I also serve on the executive board, state executive board of West Virginia Professional Educators, which is a group for teachers that you may be aware of. First of all, I am very grateful to have the insurance coverage that I have. And I've been on PEIA since 1976. Didn't use it a whole lot for a long time. However, in the past few years, past 5 years, I've been diagnosed with a chronic but life-threatening condition, and I have had many claims. And I have to say that I am impressed. Looking back over all the years, I think the claims are being processed in a timely fashion, and that has gone very well recently. Minimal problems. However, where we are located, and I'm sure you know a little more about that since you've made the trip, locally we have one small hospital, which is located in Petersburg, that serves these 3 counties. It's 30 miles, I believe, from Franklin to Petersburg, if I'm not mistaken. Due to a lack of specialists, however, this facility is not capable of handling most cases requiring a level of care above the most basic. And I know that personally, having dealt with my father in recent year. There are times when you just need to be where the specialists are. We have very few specialists. In fact, beginning July 1st, our one general surgeon will be working 1 week a month. Okay, so don't have appendicitis attack unless it's the right week. And he's a very capable person, but he is semi-retiring, and right now that's it. There is one orthopedic doctor. There's one obstetrician, maybe 2, I guess, and pediatrics. But beyond that, if you need a urologist or anything else like that, you have to go somewhere else. Seeking out-of-state care in this area is not a convenience, as I heard, I think, stated by someone, perhaps even a member of the task force. It is a necessity. It's not a convenience, it's a necessity. I'm traveling around 60 miles each way whenever I see my specialists at Centera RMH in Harrisonburg, Virginia. That is the closest that I can get that kind of care. My other choice would have been WVU Hospital, and I would be more than happy to go there. I think highly of that facility. But it is 120 miles one way, over treacherous mountains, I would say, in the wintertime. They get a whole lot more snow than what our areas here do. And the Pendleton County Highway Department does a good job of keeping the road open to go across the Shenandoah Mountain to Harrisonburg. I did travel one day this winter when it was 15 and had snow the day before and the night before, and it was passable. I even went by myself, which says a lot. I would never consider doing that, going to Morgantown. So for me, with the frequency of visits, I was last summer in Harrisonburg every week, at least one time every week, because of some complications and so forth. This winter, I've been there 10 times, just since December. So if you multiplied everything and double it, if I had gone the other direction, and there would have been days I couldn't have gotten there. So there are many other people in Pendleton County in particular who face this same type of thing. And, you know, I think most of us try to do as much in-state as we can. But if the care is just not there, and if the specialist is just not there, it doesn't make sense. It doesn't make sense for somebody in Franklin to drive to Grant Memorial just to be transferred somewhere else. And that's what happens. Then I also know firsthand, because my husband has recently in the past year had kidney stone problems. And we don't have a urologist. I think maybe there is one who comes one day a month. when you have that problem, you can't. And we dealt locally as long as we could, but that was just not a fix. You actually paid more in hospital costs than you would have had we gone straight to Harrisonburg. It would have been resolved within a day, and we would have been done. So it actually cost probably more. I'm asking, sir, therefore, that the penalties for using out-of-state care be eased for those of us who really need it. It's not a luxury, it's not a convenience, it's a necessity. And that was done previously, but it's been taken away. It has been said, I believe, and I hope I'm not misquoting, but I believe it was said that out-of-state care costs 4 times as much. I can't compare some things because I don't have a way to do that. However, I have known for years that my specialist, ear, nose, and throat specialist in Harrisonburg, had a lower office fee than my primary care physician. So I pulled out some bills to compare. And my ENT specialist was paid for an office call by the insurance $10.12. I paid $40, of course, which is fine. A hematologist, out of when everything was discounted and all that, the insurance paid $19. I paid $40. Okay, 19 and 10, that doesn't seem like 4 times what it would cost here. So I pulled out a statement, a PEIA statement for my primary care physician. Insurance paid primary care physician $52.97. And of course, you know, my copayment is $20. And even if you figure the difference in the copayments, you're still paying more to the primary care physician in West Virginia than what you paid my specialist in Harrisonburg. That's not 4 times the cost of care. Now, obviously, as I said, I don't have the ability to compare the hospital costs because I haven't had treatments 2 different places. I can't compare that. I don't know how that compares. That's up for somebody much higher pay grade than mine to do that. But I'd really ask you to make sure that you are shown the actual figures and compare, you know, the real cost between the facilities, and then let people know about that so they can maybe pick and choose where they go or make wise choices about that. All right, so I'm not going to say a whole lot more. I think that's one of our biggest things here. I do know that there was quite a lot of upset about total family income and how that was going to be figured. I really feel that the extra income that someone makes at a side job or business has nothing to do with that person's state employment. It should never be considered if both spouses are state employees, which for many of us, that's the case. I haven't quite figured out how I'm getting a discount I have a retired teacher husband. I pay more than twice the single rate for my insurance because I have him on mine. So I don't think I'm getting any discount there. But if both spouses are state employees, then only their state pay should count. That's all I'm asking. I do see the point where if the other spouse has another job in a different business, that maybe we shouldn't be carrying them all the time. I don't know. Or there should be some higher cost or something. I can really see that. That would hit some people pretty hard. And I would hate to see that, but, you know, run it like other businesses do, and I think that would be fair. The facility fee limits, of course, have hit us pretty hard, or have that potential. So I think those are probably the main big things that we see in this area, and would just like you to understand that, and perhaps having traveled here, you maybe will understand a little bit better how we are affected by those things. And I thank you very much for your time, and for coming, and for having a meeting in Franklin, because most of the hearings are held at least 100 miles even from my house, and I'm closer than most of these people are. So, and we usually don't know much ahead of time when they're going to be. So I appreciate that the task force was willing to insisted on doing that. Thank you. Okay.
Thank you. Next is Kim Klein.
Good morning, and I would also like to thank you for coming to Franklin to hear us. I represent probably the unspoken group of PEIA insureds, and that are the non-state public employees. I work as a regional epidemiologist. I'm based out of Pendleton County Health Department, right across the parking lot here. But I cover 11 counties in eastern West Virginia, from Jefferson County down through Pocahontas and Randolph and Tucker to the west. So I have quite a large area to travel. I have been in this position for a little over 20 years, so I've been under PEIA insurance for a little over 20 years, and I am pleased with the coverage that I have received for the most part with PEIA. However, I do have a few issues that I wanted to bring to light. One thing is that whenever you call in to find out if a procedure is going to be covered or if you need pre-certification for that procedure, oftentimes you get someone on the phone who cannot answer your question. If you call the next day, you get someone on the phone who may have an answer or may not have an answer. But generally speaking, when you call on 2 or 3 different days, you get 2 or 3 different answers. I don't think that's acceptable. I think the people answering the phone should know whether or not a procedure is covered. For example, I recently had an endoscopy done. I had planned to go to the gastroenterologist I'd used before in Harrisonburg. However, the facility fee kept me from doing that. So I went out to Morgantown to Ruby and had the procedure done there, and I was very pleased with the service I received. However, I do not have a diagnosis of GERD. The benefits booklet states that endoscopy will be covered for the treatment of GERD. So I called to ask about whether or not this service would be covered. And the lady asked me, well, are you having it done in West Virginia? And I said, yes. And she said, well, it should be covered. So I go into the procedure not knowing if it's going to be covered or not, but hoping that it would be. And I don't think any of us in the room are multimillionaires that we have a couple $1,000s laying around that we can just throw out there for a medical procedure that we're counting on our insurance to cover for us. Another thing that is of concern to me over the years with using PEIA is the changing in the pharmaceutical benefits. You work with your physician sometimes for a year or longer to get a medication that works for you. And then the pharmaceutical provider changes and your medication is no longer on the formulary. So then you have to pay 70% of the cost of that medication to stay on it or move to another medication. This happened to me. I had to move to a different medication, and it threw me into a life-threatening position. And fortunately, we found it in time. I was moved back to the expensive medication that was no longer on the formulary, and I went back to normal. So that is of concern to me. I think it's really important for folks to be able to stay on medications that work for them, because I don't think it's healthy for us to keep flipping medications back and forth and back and forth. I also am a diabetic. Several years ago when I was diagnosed, my health care provider at the time gave me a free glucometer to test my blood sugars. And PEIA picked up the cost, other than my copay, of my supplies, which were my strips, test strips, and the lancets. I paid $40 for a 90-day supply, $30 for the strips, $10 for the lancets. Last July, when I went to get my supplies, the pharmacist informed me that they could no longer cover my supplies. I had to get a different brand of glucometer with different supplies. I asked at that time if my insurance would cover the cost of the new glucometer, and I was told no, but if I enrolled in the face-to-face diabetes program, I might be able to get a rebate on the glucometer. So I had to contact my provider, get prescriptions for a new glucometer, new supplies, and go get those filled. I paid over $150 for the glucometer and the supplies for a 90-day supply. Now, when I go to get my 90-day supply of lancets and test strips, I pay $70 instead of $40. $50 for the strips, $20 for the lancets. 3 weeks ago, I went to Petersburg for their Healthy Saturdays program to have my blood tested, as I normally do every 6 months. Coming out of that testing, the diabetes educator said to me, offered me a free glucometer. And I said, oh, thank you, but keep it for somebody who can actually use it because my insurance will not pay for the supplies. It's not the right brand. I think something needs to be fixed with that. The other issue that I have is when you go on the website to find a provider with Aetna, the Aetna Signature Administrators, they may say that they update their website on a regular basis, a daily basis it actually says, except for holidays and weekends, but it's not true. There are providers on there listed for Pendleton County with Pendleton County addresses that haven't practiced medicine here for at least 5 years. There are also providers, my own provider, who hasn't practiced here for nearly a year, and she still is listed with a local address, but has no local office here. I don't have a lot of ability to tell you what to do to fix PEIA. I have kind of anecdotally, as the non-state public employees group, we have one premium that we pay for a single person. I pay $541 a month for my insurance. I have facetiously said that that's the way to fix PEIA. Make everybody pay the same that we have to pay as a non-state employee. However, I know that that would never work because it would bankrupt the state of West Virginia, as well as all the county boards of education trying to pay that. But I think for the same coverage as what state employees are getting and teachers are getting, that we need to get a break of some sort on our premium or some kind of incentive to bring that premium down. Because not only do we have to pay more, whenever there is a pay raise passed by the legislature across the board for state employees, local employees do not get that pay raise. There was a bill in the legislature this session, but it didn't make it out, unfortunately. And we're hoping that it will be reintroduced during the special session. So the only time that we get a pay raise is if our local Board of Health has the money available to do so. Once again, thank you for coming to hear us.
Thank you, Kim. Next on the list is Olin Hoover.
I just have one comment. I submitted my concerns on your survey. Retirees, in addition to what Ms. Klein said, get no pay raise. We used to when we were working for 35 years to offset the increase in the insurance. We no longer get any of that. And why do retirees have to pay 14% more for their premiums, co-pays, and all of that? The retirees in this state are being totally ignored.
Thank you. Vicki Hammer.
My name is Vicki Hammer. I am actually benefits coordinator for Pendleton County Schools. And trust me, I have heard it all. And I too appreciate you being here today, because very seldom do we get anybody here in Franklin to hear our voices. Actually, the two ladies before me have addressed most of what I was going to talk about. I feel like our biggest issue in this area is the ability to go out of state to Harrisonburg to get the specialists that we need. We don't have a cardiologist in Petersburg. We don't have the urologist, as she was saying. There's just so many specialties that we need that we don't have access to. If we want to stay in West Virginia, I'm not sure what's available in Elkins, but as they stated, and as you came across, I assume you came across the mountains to get to Franklin. And as you can imagine, the winter time is not a time to get sick if you have to go to Elkins or if you have to go to Morgantown for medical care. My husband recently had to have a sleep apnea test, where it would have been much simpler to go to Harrisonburg to get that done. We stayed in state and went out to Morgantown, which takes, you've got to take a whole day off of work, whereas if you're going to Harrisonburg for any kind of care, you're taking maybe a half a day, maybe even just a couple hours if you can get an afternoon appointment. But traveling across the mountains to Elkins and Morgantown, you're figuring a full day of work, which for teachers, that means bringing a substitute in. That's taking teachers out of the classroom. The facility use fee, I have noticed for myself and my family, has it's just been crazy. I called PEIA one day to check on a 3D mammogram that I had to have. Is this covered? Yes, it is. So I go to Harrisonburg, because at the time Petersburg did not have that 3D mammogram. So I go over there and everything's fine. I get a bill from Centera, $172. Facility use fee exceeded the facility use fee. And I just found out recently that I believe that Petersburg now has that. So I will be going down there, but I've also run into, even with them, getting bills that say facility use fee is too high, and that's in West Virginia. So that it affects not only going out of state, but also in state. I'm not sure how that facility use fee is computed, but I think that those figures need to be expanded to include our neighboring states. I'm assuming it's just within West Virginia that they're calculating these averages. So I really think that they need to take a look at even Winchester. I know that there are, Petersburg a lot of times will send people to Winchester because that's closest for those folks in that area. Here in Pendleton County, of course, going to Harrisonburg is the closest. And it's been a real struggle trying to stay in state. I myself have tried to do that as much as we can, but there are some things you just can't do. So they've really addressed most everything that I was going to talk about today. So I appreciate that, and even brought up some other things that I hadn't thought about. As far as a fix for it, you know, maybe there's a raise in premiums slightly. Maybe you look at families that have 5 and 6 kids. Maybe maybe they pay a little bit more. The revenue from taxes, from energy sources, that's a lot of good issues have been brought up here today. So I think there's a fix. I really do. And I think if we all come together and with ideas that you're finding throughout the state, there are folks that are coming up with some excellent sources of income for PEIA. But those are the two biggest issues, I think, are these facility use fees and being able to go out of state. The 80-20, we used to have the 80-20 going out of state, and that was fine. And so I'd like to see that go back to that when you have to go to Winchester or to Harrisonburg or any other areas. Even Charlottesville. There are times even Harrisonburg can't help you, and they have to send you to Charlottesville. Well, my goodness. That was, I had to do that one time, and it was like an act of Congress, you had to write letters. You had to have your doctor write letters in order to go to a specialist that even Harrisonburg didn't have at the time. I had to have surgery for AFib. Just about the time I was set up in Charlottesville to do that, Harrisonburg did get a doctor, and they have that now. But at that time, they did not. And it took me probably a month to get all the letters written, to get the approval to go. And then if it's going to be more than 2 trips down to Charlottesville for your follow-up, well, then you have to write another letter. And the doctor has to write another letter. And it just, when you're sick, you don't want to have to deal with that stuff. So that's really all I have. And I really do appreciate you coming and talking with us today. Thank you.
Thank you, Vicki. Next person is Jake, and I can't read the last name.
Conrad.
Conrad. Thank you.
I had too much fun, that's why I went. My name is Jake Conrad. First of all, I got a question for y'all. Is PEIA considered a Medicare supplement?
I can't answer that. Like I said,
The reason I'm saying that is because there's retirees back here behind me that, you know, everybody has always said, well, you know, I have PEIA as a Medicare supplement. So I'm just asking you all. So Humana?
Humana.
Okay.
Yeah.
Okay. All right. One other thing. I'll give you a couple of things about coverage. Last year, my wife went to, we went to Harrisonburg, she did, and had physical therapy. Had to have it on her neck and shoulder. She was supposedly, it was covered by PEIA. She was covered by 20 sessions. Into the 11th session, she was told that PEIA would not cover it. Consequently, I believe the bill was around $900 and some that we had to pay out of our own pocket. You know, now what I'm saying is either they're going to cover it or they're not going to cover it. Either they can't be doing both. And if you go, and like some of the others here have said, if you call out, well, we might be able to cover it. Well, we're not sure. You call out the next day, we think it's covered. You get into 10 or 11 sessions and you find out it's not covered, then you got to pay it out of your pocket. Retirees are being penalized, and we're also being penalized because we have to go across state lines. I'll give you another good example. I go to University of Virginia every 3 months for prostate cancer. And I have to go over there every 3 months for treatment. The doctor that sees me is he's in the top 5 doctors in the United States on prostate cancer. I'm paying a $40 copay. About 2 months ago, we went to an in-state hospital in West Virginia. My wife got the flu. We went down. Her copay was $100. Now, what's wrong with that picture? There's something bad wrong with that. So I'm just saying that there's things that need to be fixed. I don't have the answer. Some people have talked today about oil and gas kicking in on it. That's a good possibility, but I'm going to tell you, you're up against it because the senators and congressmen in the state of West Virginia are enjoying their real handsome dividends that they're getting off of it. So you're going to be up against it, and you probably already know that. So I don't know what the answer is on fixing it, but I do thank you all for coming today. But there is some terrible problems with this that need to be fixed, and they need to be fixed now, you know. So I think, one other thing, helicopter coverage. A lot of times by being on state line here, we have to be, flown to University of Virginia, $40,000 hospital bill if you get get helicopter insurance. You know, Medicare, I'm under Medicare, it pays, I think, somewhere around $12,000. Now, am I supposed to tell a helicopter pilot, stop over on 11, or I mean over on 70, whatever that route is there, and when you get up to whatever you're going to pay, stop me there and let the ambulance pick me up on the rest of it? This is ridiculous. That's just one of the things. Thanks for coming.
Thank you. Next on the list is Cindy Rexroad.
I think everyone's pretty much stated my concerns. I do have one thing, and I know you all are not the legislature.
If you wouldn't mind to come up, because,
sure.
Please.
When a few years ago, West Virginia had a food tax, and now we have none. I assume most of the bordering states do. I know Virginia does, which we share a huge border. I mean, possibly if we re-implemented the food tax in West Virginia, that maybe this could be applied. I mean, it certainly took a lot of funding away from the state of West Virginia in general when we lost the food tax. I mean, I don't like more taxes. Nobody likes more taxes, but possibly, we could think about re-implementing a food tax in this state. I think like I said, most surrounding states do this. I don't know. I mean, just a possibility. I mean, I certainly feel the out-of-state problems that we've all talked about. I mean, I feel like when I've talked to providers that Aetna Signature is a problem. I mean, it's not a widely accepted insurance from my experience. And I've experienced the doc find problem. You go on doc find, it says that this person is a provider, they're the closest provider to you, they're in a bordering county in Virginia, it's going to be covered. You call them and they say, oh, you better check with the provider and make sure they accept Aetna Signature. So you call the provider, yes, we accept Aetna Signature, and then, it's denied. And I mean, it's ridiculous that, that we constantly have to fight for a benefit. I mean, and that's the way I feel. I mean, I don't know how many other people in this room feel this way, but I feel like I constantly fight for a benefit. I mean, I don't mind a premium increase if it means a better benefit. But if it's going to be the continued fight that I feel like I always have to do with PEIA, then no, I'm not in favor of a premium increase. I mean, I don't feel like we're well represented by this insurance in this state. And I feel like everybody wants to know why people are leaving West Virginia. Well, there's another good reason. Maybe, you may as well live in Virginia if you have to. And I looked in my book this morning on benefits, and according to the book, there are HMOs in Ohio, in Maryland, and in Pennsylvania that, are accepted. But there's nothing in Virginia. Nothing. We share a huge border with Virginia. I don't understand that. That's all I have to say.
Thank you, Cindy. Gary Rexroad.
Glad to see you all come to listen to us. Usually we don't get anybody to come see us. First off, I'm going to say PEIA sucks. I'm just going to put it bluntly. It's simple as that. It used to be when we worked for the highway department, you had good insurance. That was part of the perks of working there. But since insurance went to this, it just ain't perked more. The health care she's talking about, she never mentioned, we called them up about a podiatrist. And they said it's covered. Well, after it was all said and done, we had to pay it. They didn't cover it. And my one cousin, which is not here today, his wife had to have back surgery. And I never said they were going to cover it. I said, you want to tell you what I do with them? Make sure you get it in writing before you go, because I wouldn't trust them. It's simple as that. And they talk about financing this thing. Well, what happened to all that lottery money? We put this lottery in, and it looks like there ought to be some money for that to do something with. But several of these people around here talking, by gosh, I agree with what they're saying. I mean, they said the same thing. They beat me to it, the punch, but they're saying the same thing that everybody's thinking. I mean, insurance is not worth a darn anymore. Something needs to be done badly. So I think I'll leave you all alone with that one. Thanks for coming.
Thank you, Gary. Next on the list is Joyce Bland.
I agree. Everyone said what I was going to say. And I am a family of 4. So can you imagine a family of 4 paying? I've been going to a specialist also in Harrisonburg for a medical condition that I have, and I have to see that specialist to continue my medications. Well, I went recently to the same doctor I've been going to for 8-10 years, and I got a bill for $482 that they say I have to pay because of facility use charges and things. Medication, I don't even use my insurance to buy my medication. If you shop around and you get discounts, I pay cash for my medication because it's more for me to use my prescription card to buy my medications right now. My son also sees a podiatrist. We've been going several times. I said, fine, find me one in the state of West Virginia, I'll be happy to go. Guess what? My bill was more than the one we had currently seen, and I am currently paying on a $614 bill for him. And then I agree with calling. You're misinformed, you call repeatedly, you write letters, and the last letter I wrote, I said that I had expired my time and the issue was done. Excuse me, the issue wasn't settled. One issue I did win because my conversation was recorded and I was misinformed and they did cover the bill. But I'm a family of 4 constantly paying these bills. And if you start including my whole family's income, we work secondary jobs so we can survive. I mean, it's just, I agree with everything that has been said here. It's just, it's gotten this way over the last 2 years because I've been going over there to the doctor for 8 and 10 years, and I'm willing to pay those extra costs, but they've just gotten outrageous. And I always thought that when a doctor or a facility agreed to accept your insurance, I thought we weren't supposed to pay all the extra costs. So what happened there? That now there's a limit to the facility use, which never was. So I agree with everything that everyone's saying. I don't know the solution either, but I quit a higher paying job to go to work for the school system when I had 2 children because I needed the health care. So I went to a less paying job because of the great benefits we had. But they're just not great anymore. And I mean, me and my husband, I work 2 jobs to survive. I mean, I'm paying on all these bills I've gotten. And I can't afford to pay them, so I have to pay payments. It's just, you know. And again, I agree, why should we sit on the phone every day and write letters every day? It's ridiculous. Thank you.
Thank you, Joyce. Next is Ron Hudson.
Unlike everybody else here, I have the fix. If everyone on the task force, all the legislatures and all the senators use PEIA, they would find a way to fix it.
Amen.
Jamie Hudson.
Hello, my name is Jamie Hudson, and I feel like I have a little unique perspective to this. I'm a CEO of a health center in this town and in this county. We also are a non-state agency, so we supply insurance for our employees under PEIA, so I see kind of both sides of what is going on. Some of the concerns that I have both as for our patients that have PEIA as well as our employees that have PEIA is what has been spoken about with the regional fee limits and the decreased amount of co-insurance that's paid when you go to a bordering state. Patients that we've had that have seen a provider in the state of Virginia for a long time and may not need to have a procedure done at a hospital, all of a sudden needs to have something done. Well, they get stuck with a $4,000 bill because they had to have an MRI done. Or they get stuck with a $3,600 bill because they had cataract surgery. That's in addition to their out-of-pocket that they are responsible for and their deductible that they're responsible for. And they really had no way to plan for that. When they go to the hospital to have their surgery, they don't know what the hospital will charge them and what PEIAs will end up paying for that. I mean, PEIA lists what the facility fee limits are in the book, so you can look at that, but you still are not real clear in what the hospital would charge. So we have patients that are either not going to go get services because of various things. They can't travel to Elkins or they can't travel to Morgantown, so they don't do it. Or they uproot their normal care and they transfer to another provider, which means when you do that, you have to start a lot of the process all over again. So it's additional medical bills because that provider is going to want all of the history and all of the testing again. So it's not good for a patient to have to lose their continuity of care. It's not good for patients that it may cause a barrier to their care because they're putting off some of their tests because they don't know what their bill's going to be. When you sign up for insurance, you know this is how much my deductible is. This is how much my out-of-pocket is going to be. And you can somewhat plan for that. You can't plan for what the facility fee limitation could be. So that is one of the biggest concerns that I've heard both from our employees and from our patients is the continuity of care could be interrupted, which is not good for a patient, and the barriers to care because they're avoiding going to get things because they don't know what they're going to get hit with. Other than that, I think in the past, PEIA was good insurance. I can say that because I see all different kinds of insurance. We deal with the health insurance marketplace, so I know what's out there and what's available. And I feel like before PEIA really started making the changes and decreasing the co-insurance coverage and the facility fees, it was okay insurance. Did you get to go everywhere you wanted to go? No, you did not. But I feel like in this day and age, that's kind of where healthcare is going. There has to be some limitations around it. I don't know, I don't personally agree with that, but that's where I see that this is going. But I feel like in a bordering county, you should be able to get to a close facility that doesn't create a barrier. Thank you all for coming. I appreciate you listening to us.
Thank you, Jamie. The next person is it Helen Turner?
Yes. I'm here as an employee of Pendleton County Schools and as a parent of 2 young children who both have ADD, ADHD, as well as other health issues. The one issue I want to talk about that hasn't been talked about today is it's my understanding, and I could be wrong, that during the teacher strike of 1990, one of the conditions of getting the teachers back to work was PEIA was beefed up and fixed. Because at that time, I have been told, most health places wouldn't even take PEIA. If you had PEIA at that time, you couldn't even go to the doctor because nobody would accept it. And PEIA was beefed up, and we had really good insurance for a really long time. And then all of a sudden, that went away. And everybody here, I'm sure, will agree, in this day and age, people take or leave jobs based on benefits, based on insurance, based on retirement. And last I knew, we had over 700 vacancies in West Virginia for teachers. I know we have them in this county. They are being filled by very nice people who are doing a very good job trying, but they are not qualified to teach the subjects they are teaching. And my son is in that situation right now. And as a parent, it upsets me that we cannot get qualified teachers. And as a parent, I feel that if we offered better benefits, because we sure can't pay us anything, but if we offered better benefits to compete with some of the neighboring states, maybe we could get some teachers, especially counties like us who border Virginia or counties who border Maryland. I see that as being a significant issue. And I think better benefits, better PEIA, because everybody hears the horror stories, would help us with recruitment and retention. And as a parent, that is something I'm deeply concerned about. The other issue I have is deductibles for medication. Both of my children take a generic medication for ADHD or ADD. Our plan year starts July 1st. Every year, July or August, we have to meet with their doctor to go over what their medication is going to be that year, whether it needs increased, whether it needs changed, whatever it's going to be. When I go to the pharmacy to fill those medicines, one year, I think it was the year before last, I had to fill both medicines the same day. The one was $189 a bottle. The other was $169 a bottle. And I had to fork that money out right then, right there. That's not right. Nobody should have one pharmacy bill. And I know that's minor compared to what other people have. But if I haven't now learned to prepare for that, and I was not prepared for that day. If you do not learn to prepare for these big whopping bills, it can devastate a family. And the other thing I'm concerned about is it can be hard to get into a provider because there are so few and far between. And I'm not complaining about that, but a lot of times if your child is sick and you call PCC or wherever, they can't see you for a couple days if then. They have same day appointments, but you have to call by like 8:40 in the morning or you're not getting in. Okay, there's some express cares around. Used to be the copay for an express care was the same as it was for your regular doctor. Now it's $50. My son hit a temperature of 104.9 last winter. We went to the express care because what this was going to do was Friday night. I got a $50 bill for the copay, a $40 bill. Nobody could even explain to me why I had that bill, but I had to pay it, plus x-rays, plus these medicines. Many times, people with young children, your children get sick in the evenings, or they'll get sick, in the afternoons. You've got to decide, do I want to pay the extra bill to go to an express care and have this $50 copay plus whatever else, or are they not sick enough that I can maybe wait till the next day and try to get them into a local provider? You shouldn't have to gamble with your children's health because you're scared of the bills. And the other thing, when my kids get sick, I've got to decide, well, if I take them to the express care tonight, maybe they can get some medicine and get better, and I can go to work in the morning, and maybe if it helps enough, they could go to school. Or do I wait, take off another day of work, another sick day, lost wages, not lost wages, but lost time at work, use my sick day, they miss school, and we try to get into a local provider that you may or may not get into. That shouldn't be an issue, I don't think. I shouldn't have to miss sick days when I can go that evening and take my kid and not have to worry about missing a sick day. Those are the main things I have. I disagree, though. I'm not willing to pay more for the coverage we got. If you can beep it back up to what it used to be years ago when it was a benefit and everybody talked about, oh, wow, you got a state job, you got PEIA, you're set. Then I'll consider paying more. Then I'll consider higher deductibles. But right now, it's not worth what I'm paying.
Amen.
Thank you, Helen. Charlotte Hoover.
Good morning. I also am an employee of Pelton County Schools, and I also am a member of Pelton County Emergency Rescue. What I have to say is 6 years ago, my husband got cancer, and we ended up going to Morgantown, and he had to have a bone marrow transplant. We started out in Harrisonburg. He was in Harrisonburg the first time for a week. Then we got sent to Morgantown because Morgantown is the place that could do the bone marrow transplant. We went there the day after Thanksgiving, and we got home on the 5th of January. Then when 9 months later, my husband passed away from his illness. Before he passed away, he was in Harrisonburg again for the weekend. The biggest bill that I ever got, for the biggest one-time bill that I ever got, was a little over $800, and that was on a $64,000 bill at Rockingham. When we had other bills that would come, but that was the highest bill that one-time bill that I ever got. I have no idea what the bill was when we went to Morgantown. I never saw a complete total, but like I said, he had a bone marrow transplant, and we spent days. We was at the hospital every day that we was there. On the weekends, if we couldn't go to the cancer center, we went into the hospital and he was checked. They told us that before they did harvested his stem cells, we had to go at 10 o'clock at night, and they give him a shot in the back of his arm so that they could harvest his stem cells. They told us that shot was $10,000. I was very pleased, very, very pleased with what they paid towards his care, because when I add up the second time that he was in Harrisonburg, it came to $46,000. So I know that the two bills at Harrisonburg was over $100,000. Very pleased with how they paid then. When they talk about going for care, I run with the rescue squad. Normally when we transport people, most of our people either goes to Grant or they go to Rockingham and Harrisonburg. North Fork goes to Elkins with a lot of their folks. Sometimes we even go to Augusta Medical in Fishersville, which is close beyond Stanton, Virginia. But if you have a medical emergency, if you're having a heart attack, the closest center, if you go to Petersburg, they're going to ship you to Winchester. If you go to Harrisonburg, they have a cardiac unit, and they can take care of you there. If you're having a heart attack, you don't have 3 hours to ride an ambulance to Morgantown. Also, in our training with the rescue squad, we know there's another hospital in Charlottesville besides UVA, which is Martha Jefferson. They have done leaps and bounds when it comes to stroke therapy. We had a training where they came over here and showed us that, they have the techniques that they have can make the difference in a person's recovery. It's hard for me, where we live, it's hard to expect when we pay a premium for insurance that we can't go get the care that we need. When it's an hour to Harrisonburg or 3 hours to Morgantown, and I made that trip many, many times. I hope that, and a lot of people said this better than I can, but I hope that you would consider, there was at one time that we could go to bordering counties, and I hope that is another thing that you'll consider. One of my coworkers told me that they heard on the Metro News that PEIA was either a $62 or $65 million surplus. They was curious about what was going to happen with that. And we're talking about the food tax. I think the food tax would be fair to everyone because everyone pays it. And when we was talking about that, there was a guy that, and I don't remember his name, but there was a politician that advertised that he was responsible for getting rid of the food tax, which saved West Virginians millions of dollars, that along with other things. But when we've lost that, then we've lost our health care, which is not good. And the food tax used to be 3%.
It was 6, and then they attritioned it away.
Okay. Again, to emphasize what Jake said, I've also heard one of our legislators, local legislators, said that PEIA could be funded with the tax from the fracking from the natural gas. That could be done, but again, it was told that there's too many politicians that are receiving benefits from that, so they won't use that. I also had somebody else tell me that the standards that they have, like the 20-inch waist and the different standards that they have for that, we're not all made alike. We all have different genetics. Some of us that are lucky can be a pencil-thin person, but we all can't. And part of it's genetics, and people feel like they're being penalized because You know, that's just not doable. It's like saying every kid in school is the same. You know, they got to be treated the same because they're the same. Well, everybody's genetic makeup is not the same. And not everybody can have a 20-inch waist. And another thing that I've heard is that if this isn't resolved, the teachers are already talking about another strike at the beginning of school. And I don't think that anybody wants to see that happen. I certainly hope not. And one other question. We had, this is more of a question. Someone called PEIA to find out why our deductibles are so high, or why things weren't being paid as they were before. And somebody at PEIA told this person that our Board of Education upped our deductibles so that it would lower the premium that they paid for us. Is there any way if we can find out that that's true?
Yeah, Thomas, you still back there?
Yeah. Thank you for coming to listen.
Talk to her and check on that for us, please. Okay. Thomas in the back will address that.
Thank you, Charlotte. Next is Michelle.
Connor?
Yeah, I'm sorry, Michelle Connor, yes.
My name is Michelle Connor, and my husband is a public employee. I believe he will be speaking here shortly. But I did have the opportunity to see the PowerPoint presentation that was put together by Ted Cheatham, and I appreciated his explanation about how it is virtually run as a nonprofit. But a comment that I have about that, I've worked in the nonprofit sector for over 15 years, and I do think that someone needs to take a serious look at that operational model, because I think there's a difference between a government-run program, which is a government-sponsored enterprise, versus an independent nonprofit. So the government-sponsored enterprise has to answer to the state, and it focuses on reducing costs to the state, versus a nonprofit model would be more like taking in consideration the stakeholders, which would be the people that they insure. So I think under those two models, you end up with very different results. The second idea that I would just like to present relates to Mylan Pharmaceuticals. So currently the PEIA model supports using West Virginia providers. And frequently those providers agree to accept a lower payout. I believe in Ted Cheatham's PowerPoint presentation, he indicated that that payout is similar to Medicaid rates. So Mylan Pharmaceuticals is a large distributor of pharmaceuticals. So perhaps some creative minds could work with Mylan Pharmaceuticals. Clearly, they're a profitable philanthropic pharmaceutical company that is here in West Virginia. So asking them to take on that similar model of accepting a lower rate. So for example, maybe that could be a rebate option that was given to PEIA, that drugs could be purchased at cost. Again, asking a West Virginia company or West Virginia provider to kind of contribute and kick in might be an option to look at. And then an idea that I believe was maybe mentioned by the Board of Education, I picked up on their letter of support when teachers were striking. One of the things that J.P. Mowry had indicated was that, you know, perhaps, and this is from me, not J.P., I'm not speaking for him or the school board, but I was intrigued by something that was mentioned in that support letter, which is perhaps there could be creative options that would subsidize subsidize a county to come up with their own local solution to use those funds. So the percentage of the overhead costs that PEIA is already utilizing could be freed up to pay for that money, or that money to be able to be used locally, especially in counties like ours, border counties, where you've heard repeatedly today that lots of folks don't just choose to find an out-of-state provider, but need an out-of-state provider. So if a local solution, I mean, in my experience working in the nonprofit sector, local communities frequently can find creative ideas that are that meet the needs of the local people and local employees here, versus trying to find a centralized solution in Morgantown or Charleston that, that really border counties just have very different needs. right, thank you very much.
Thank you, Michelle. John Connor, please.
We'd like to thank you again for being here and traveling as far as you have. For those listening in and watching from across the state, the other task force members, I thank you for participating and listening to our neck of the woods and the concerns that have been voiced. I would simply reiterate several of those as I tried to prepare comments for this morning's meeting. About 3 of the things I intended to share have already been shared, and I will just quickly reiterate just the maximum allowable costs and those facility fees that have been spoken of is a big issue and a concern for our family. And particularly changing the pharmaceutical management company or third-party provider of those pharmaceuticals. You've heard some of the challenges that presents when you're on a regimen of care, especially for folks with chronic conditions. Having a formulary change every 12 months because the PEIA chooses either on a whim or through circulating around contracts, or they shop it around and just, again, trying to save costs to the entity, choose to go with a different provider because maybe that contract is a little bit less. Sometimes you get what you pay for, and so that can create some havoc. I wanted to mention as well that I don't think it's specifically been spoken of, but I just wanted to throw it out there as a possibility of privatization. I know that at the surface level, in fact, I think perhaps even in Ted Cheatham's presentation at one of your initial task force meetings, it was said the premiums would be so much more. I mean, we can't begin to compete. If you would take it to the private sector with like a Blue Cross Blue Shield, do you realize what those premiums would be and what that would mean for the stakeholders, for the insured, for the counties and the various state agencies and entities that have to backfill the employer portion? I don't think you should just completely dismiss that option without fully counting the costs, because as we've heard time and again here, the net, you take the big picture, the whole big picture into effect. If it would result in a higher premium, but at the end of the day, when services were utilized, resulted in a less out-of-pocket, such that the net cost over the course of an insured year would be less to we, the employees and the hardworking state employees of our great state. If that would come in at actually as being less, that monthly premium that may cost the employee and the agency that employs them might be a palatable pill to swallow, pun intended. So just because I heard it pretty quickly dismissed early on, that the privatization option may not be viable, I think that it merits members of the task force, a subcommittee or what have you, and I believe there is one that might be looking at that, but I would encourage you and those listening on that task force to please just take a look at that. Don't necessarily run with it, but look at it and come up with a valid, legitimate, real cost analysis of what that might look like for our state. And if I'm not mistaken, I believe perhaps the CEO of what used to be Mountain State Blue Cross Blue Shield, whatever they're called now, I believe you've got some expertise from at least one, if not two, private insurance companies on the task force. I would also have to believe that there's quite a bit of leverage associated with the number of employees that are on PEIA. An account, if you will, I hate to think of it in that regard, but let's be businessmen and women here. An account with that many clients of the size that the state employees represent has to be worth some negotiation and leverage power when you would be talking to a private insurer. I also think that would take a lot of the challenges associated with the border counties, of which we are one, perhaps out of the equation or lessen the impact that you've heard has impacted us greatly. And at times I feel like I'm alone. I think one of the biggest advantages that came out of the work stoppage was the unity that came from within our community and across the state. So often we feel siloed up and we're in our own little silo, unconnected, disconnected from others, and we think, oh, is it only our family that are having these problems? Kim, your account of your endoscopy situation impacted our family directly when we had that endoscopy in Rockingham County, and were slammed with a multiple $1,000 bill because they only paid $824, which was the maximum facility cost for that procedure. So suffice it to say, anything that could be done to try to overcome the challenges of less coverage being paid to those of us, and for those that aren't familiar with the geography of the state, 29 of the 55 West Virginia counties are border counties who have, I'm sure, top-rate facilities in a much less distance from where they find themselves than traveling to an in-state provider. I understand and certainly can commend PEIA's desire to drive service and business to West Virginia businesses, but I think when it comes to individuals and their families' health care, it's beyond the state. I think it is a regional, if not nationwide, issue. Incidentally, my wife did not mention it, but she travels frequently with business. On one of our last pregnancies, found herself in Atlanta, Georgia, at a meeting, and had to actually go to the emergency room at Emory University Hospital, and PEIA would only pay 40% of that emergency room visit, even though it was related to the pregnancy and was an emergency, and we would have assumed wouldn't have had to have had pre-authorization because it was an emergency room visit. Well, suffice it to say that hurt our family financially as well. I do think that the task force has a large and weighty responsibility before yourselves, and I do not take that lightly. I commend them for their work. I appreciate the effort. Use this time of the freeze wisely so that we can try to come up with a legitimate fix to PEIA. As it's been voiced by several who spoke before me, I genuinely believe that the health benefit, the benefits across the board, health insurance being just one of them, has forever been part of that social compact that our state has with its state workers. Nobody becomes a state employee to get rich, and we know that. Despite the stoppage and despite a token raise, we're still not getting rich. As speaking for teachers, and I know many of our other public employees are paid at even a less rate than the teachers are. However, the benefits have got to keep up and be supported. And I know historically legislatures have tapped into rainy day funds to kind of backfill this. I think everyone, what certainly I feel has been brought to light is the fact that PEIA is ailing, has issues, has significant issues, and maybe they've been quietly dealt with, but through creative financial models and robbing the rainy day fund to backfill costs. I appreciate the weighty responsibility and task that is before the task force of trying to come up with a fix, but it is so imperative that a workable solution is met. And I guess I would just part with one suggestion or recommendation. I certainly support a severance tax on energy. I am not a West Virginia native, but like so many, I got here as quick as I could. And I may not have been born here, but I do plan to die here and be buried here. Hopefully no time soon. But I think it's high time that West Virginia stops allowing our natural resources to be taken willy-nilly and for the benefit of those outside the state with little to no financial benefit to the citizens of West Virginia, the common folk. And so I certainly support that, and I know that's not a popular one. Another probably equally unpopular suggestion, though, that I do leave with real intent is take a very hard look at the soda tax, and whether it be an additional soda tax or a real hard and unpopular look at the soda tax that has been chronically benefiting West Virginia University since its inception. My understanding was around 1950 when a facility was first built and has remained in place since, primarily benefiting only one singular entity in the state of West Virginia. I think there would be some funds available there if someone looked closely and deeply. And I know there are folks at the Capitol that would be more than happy to share that information with interested parties. So thank you for your time. Thank you for traveling as far as you have. And I want to thank my fellow Pendletonians and regional representatives that turned out. I've seen some of the meetings not as well as attended as this one, and I'm proud of our folks, as I knew that they would come out in force. So thank you all for being here today.
Thank you, John. Have I missed anyone? Is there anyone else that would like to speak that didn't sign up? That Senator Stallings, would you like to say a few words?
I'm Senator Ron Stallings. I'm a physician from Madison, West Virginia. I represent the 7th Senatorial District, Boone, Logan, Lincoln, parts of Mingo, and parts of Wayne counties. 33 years as an internal medicine doctor and geriatrician in my hometown of Madison. I've loved coming up here. It's a beautiful place. Franklin's a nice little town. Reminds me kind of back in my neck of the woods. Over the past several years, we have cut taxes to the tune of about $800 million. Corporate net down, business franchise gone, personal income tax down, food tax gone. And at the same time that all happened, Coast severance went from about $450 million down to about $100 million. So we found ourselves in a pickle. And so what did we do? We cut services. PEIA is a service, so to speak. So is Child Protective Services. DHHR is down $180 million. People with the ambulance service, Medicaid pays you 29 cents on the dollar. 70 ambulance services are gone in West Virginia now. So people want a downward pressure. Folks, we're past the bone, we're in the bone marrow. Amen. We are. We can't cut our way out of this thing. We've tried to. We've hoped with the cutting of the taxes, businesses will flood in here and we'll grow and diversify our economy. In my area, we've lost 40% of our economy. That's Deskins from WVU. This area is about a 1%. Every place else, we lost 40% of our economy because we were not diversified. We were totally dependent on coal. So, in order to balance this budget, what do? You all are seeing it. We cut infrastructure funding. We cut higher education funding. That's how you grow the economy. We keep cutting and cutting. So it's from my standpoint, it's frustrating. I just think that we have some great days ahead of us, but we also have many challenges. In my district, they had to put 8 new Child Protective Service workers in Boone County because of our opioid epidemic. We have kids, displaced kids, that no longer can stay with their grandparents or somebody like that. They're putting them up in hotels. So we have a lot of challenges and a lot of heavy lifting to do. And I, for one, am going to try to find a way. So we have to grow the economy. We have to become a healthier population. If we lower tobacco use in West Virginia by 1%, it saves $26 million a year. If we lower obesity rates by 1%, we save $56 million a year. Now, what did our legislature do recently? We totally zeroed out the tobacco cessation program. We totally zeroed out the Cardiac Project, which is the 5th grade school-based obesity prevention program. And we zeroed out the Center for End-of-Life Care. $150,000. And folks, if you don't have an advance directive, you probably ought to have one. What happens if your heart quits beating? Doctors like myself need to have that talk. Because if you end up in an intensive care unit, you know what? You're going to end up with a big bill. And it's probably going to be futile, or many times it's futile. So we're spending an awful lot of money at the end of life. We're not spending enough money on prevention. It shouldn't cost you anything to have some tobacco cessation counseling. It shouldn't cost you anything to have nutrition counseling or anything like that. And it ought to be easy for you all to have a place to walk, like right around here. This place is a walkable community. It's great. It's a tough time. I appreciate you all being down there and talking 55 strong and things like that, because we're going to have the guts to quit trying to cut our way out of here. We're going to have to spend some money. We're going to have to give you all raises that are meaningful. Okay, and it's going to take a funding stream. It's going to take a funding stream. Now, I'm not talking about, and I was a co-sponsor on the pop tax, to increase the pop tax. Okay, those are tough things in society where you want to raise taxes. Well, we've cut taxes $800 million, and look where it's got us. So anyway, I think we have a movement. I think you need to pay attention about this coming election and find out who's going to be willing to fund PEIA and come up with a funding stream. And then we all have to do our own part as far as trying to become a healthier population. And we need to, I need to be careful on what tests I order. Not everybody needs an MRI. Not everybody needs a CT scan. But that's where the money is. I'm telling you what, man, technology, pharmaceutical costs, that's what's driving this huge train, and it's national. And I'll tell you one other thing. I'm an internal medicine doctor, but the Academy of American Family Physicians, who would never call for this, are now calling for a single-payer system. Because there is so much bureaucracy. Here's the health care pie. And the insurance companies is a big piece of that health care pie. Okay? The other thing are pharmacy benefits managers. And they are taking a big piece of that pie themselves and telling me what medicines I can give. And I'm telling you, I heard these stories. Listen, I end up having people on 2 or 3 different cholesterol pills. Well, you had me on Pravachol. Well, my insurance company wants me to change to Lipitor. So I'm taking Lipitor and Pravachol, or 2 different blood pressure medicines. I mean, that's scary, really, from a health standpoint. So, again, we pay attention. I think by you all turning out like this puts us on notice. I'm one of 134 members of the legislature. And there's you all have 2 senators, and you probably have a delegate or 2. You better talk to them and find out where they stand. And then go to vote. What's that?
When it was coming time for a raise, you all voted your all selves a darn pay raise and cut us out. I remember that.
Well, I make $20,000 a year being a senator.
That ain't where your money's at. Your money's at being a doctor.
My money, so it costs me a lot to be in the Senate, because I do have to take some time out of my office.
Do you have PEIA insurance?
I don't.
Be thankful.
Let me tell you what, folks, it's not just PEIA. I mean, I got an MRI the other day because of new onset dizziness. My out-of-pocket cost was $1,800. We were a small 2-doctor private practice until we went belly up. Now we're owned by somebody. You don't see any private practice docs out there in West Virginia now. They're all owned either by a hospital or a federally qualified health center. Yes, sir.
What would happen if you got rid of Humana Advantage? We have to have that.
Those are managed care type organizations.
And they're the ones that tell us all these lies.
Well, I mean,
True. 3 different opinions, 3 days.
yeah. Again, it's a complex issue. I don't have all the answers either, but I can tell you I've got 33 years in the practice of medicine and caring about my patients and seeing what happens to you all and knowing what not having a cost of living adjustment is like, because your buying power is much lower than it was a long time ago. So those are all things that we have to pay attention to and do our best to fix it. But I think you all are a huge part of the solution.
Did you all put in act that, do Medicaid people have to be drug tested? Is that part of the thing now? Was that considered?
Yes, it's DHHR has a drug testing policy for anybody that's receiving public assistance.
Well, I think that's a good thing, because I have to be drug tested for my job and I work for my money. Is there any way to put some sort of, there's a lot of abuse of the Medicaid system. A lot of abuse of the Medicaid system. If you could cut out some of the abuse of that and some of the waste that goes on there, you could.
Well, it's an unhealthy population, no question. And they have fast, frequent health care, free.
What about people that can't read and write and they're getting disability? I mean, they came up through life and they're 40 years old and now they got approved for disability because they can't read or write. Now, how'd they get through life that far and how they have a driver's license?
I don't know.
To me, that's an abuse of the system.
The Medicaid system somehow, in order for us to balance this last year's budget, they took over $150 million of Medicaid money that could draw down 3-to-1 match to balance the budget. So they don't pay for oral health, adult oral health, and they don't pay for, ambulance services. Again, people are going, these ambulance services are going bankrupt because of Medicaid reimbursement. I mean, there's a lot of issues out there, and but until you hold people like myself's feet to the fire, they're going to, stay out there.
I was on a squad call for a person with Medicaid, and they were complaining because Medicaid didn't pay for their dental health. I don't have dental health insurance. I have to pay out of my pocket.
We do have children's dental health in Medicaid.
It wasn't a child.
Yeah. That's a different issue, I think. But
if you could cut the abuse of the system, you could save money.
yeah.
It is being abused.
It becomes a generational thing, and that's
Yeah.
not right.
Well, it's absolutely, and this opioid epidemic. And if we're going to try to save money, we better start doing some type of harm reduction, because Hep C and HIV/AIDS and all this stuff. You wait till that big train hits you, and it's percolating right underneath the water. Any of the public health officials? Yes, sir.
Just one thing I'd like to say. I worked for 27 years, retired. I could work the private sector, as a project supervisor out in construction jobs for the DOH. I could work the private sector and make a lot more money. I quit working for the DOH. But I went to work for the DOH, got my retirement, my PEI, my insurance. Okay, once you retire, then your insurance skyrockets. We never get a raise on our retirement. So actually, we're losing money by retiring.
That's that cost of living thing we talked about.
Yeah, I mean, we need somehow to get equaled out there with our retirement to help pay for our insurance.
Yeah, I agree. Yes, ma'am.
First of all, thank you for coming, even though you're not our representative. Secondly, I have a question. We're talking about retiring and everything. Is the freeze that is in place for PEIA that goes till July 1st of next year going to freeze retirees' insurance because we start on January 1?
I don't know the answer to that. I'm told it's yes, it's frozen for retirees too.
Thank you.
Thanks.
All right. First of all, I want to thank you all for coming out. This is so important to us to take the information and and get back to the full task force. But our work's not finished there. And for the record, yes, I have PEIA. I'm a teacher, so covered up.
We're talking about that.
I absolutely do. But what's important is when we come up with recommendations from the task force, and we all believe that there has to be a funding revenue source, you have to remember that has to come from the legislature. So as Senator Stallings says, it's important for us to keep the pressure on our elected leaders, because they don't let me vote in the House or the Senate. I've tried and they say no. Yeah. But it's important for us to make sure that we keep the pressure on them to let them know, because there has to be some solutions to this that we can all come up with, and that's the final piece of this.
Thank you, Dale. Again, I just want to thank everyone for coming as well. Don't forget to turn in your surveys if you completed those. There is a PEIA website. If you think of something after you leave today and you want to go online to the website and leave a comment, I encourage you to do that. It's PEIA taskforce.wv.gov. And with that, we just want to thank you for coming.